Search engine optimization. Well, most of you that know me know that these are things I don't know anything about. And I have become a bit of an avid, if not a rabid student of trying to figure out all of this distance learning and social media and search engine optimization, SEO, and figure out how to make that work in my favor, because certainly everyone, without exception, understands that being able to, if you're not visible on the internet, as Len and Evan say, if you're not visible, you are invisible, and no one can afford to do that and be in business. Evan Lazarus, as I've already mentioned, specializes in SEO, or search engine optimization. Evan, tell us a bit more about what that really means.
Well, I mean, you hit the nail on the head. It's the key word, and I say that with a bit of SEO humor, is visibility. You nailed it. It's visibility. It's when people have an issue, or they're doing research for whatever it may be, whether it's dentistry, orthodontics, or even buying a car. People go to the web. This is how we consume. This is how your patients consume. They want to know, and everybody has sort of their own objectives in their research. Research can be as simple as, where are you located? When are you open? Research can be, what services do you perform? What insurances do you take? And the list goes on and on and on and on. But simply put, if your business does not appear to that searcher that is local to your practice, somebody that you want to be in front of, then you don't exist.
And Len, there's some bizarre statistics about how many people don't even go past the first page, or what do you call those three things in Google, the snack pack, or
the local snack pack, also called the map pack. Yeah. There's very few people that ever scroll past page one. So if you're not on page one, you hit the nail on the head, as Evan and you had discussed. It's you're invisible, and without visibility, you're not going to get any patients to come in. I'll share with you a quick example. Small town, Connecticut, 200 plus Google reviews, by far the most in the town. They had something that everyone was looking at that was blocking their page, because you simply type dentist in their town and they were not even on that map, or even below when you had to go to more places. So they have got this great reputation, but they're not even able to show it off. So, I think the key to being found online is just being more visible. Obviously credibility is a whole separate topic, but visibility is tremendous nowadays.
Well, what's interesting to me about that is I like to think, as I think most people do, but you think you're kind of a unique individual. And when you pointed that out to me, Len, a while back, about not going past the first page, the reason I found it humorous is that's what I do. I mean, it's like, if you're not ranked high enough, why would I be interested in you? I don't go to restaurants that I can't search. I don't stay in hotels I can't search. I don't go to some sort of adventure that I might be having around the world before COVID that I can't find out about. So the importance of this is nothing short of daunting. Wouldn't you agree, Evan?
Well, you know what they say, Jar. The best place to bury a dead body, it's the second page of Google. Yep.
Well, when you're doing this SEO, these projects, and Evan and I have recently, I found out through Len about Evan, and now I'm looking forward to what Evan can do for Nathos, because as anybody in Nathos realizes, I'm just not finished with this yet. And when I decided to step back, it's not because of a lack of intelligent marketing. So give us some example of SEO kind of in action, if you would.
So the best way to do that, I think, would be to make it visual. because SEO is really challenging for a lot of people to get their hands around if I sit here and talk about it, because it just doesn't quite have the same effect. For the consumer, it's all about search, right? We go to search and it's what we see. So if I share my screen, I think this will be a really easy way to do this. And if I type in a very generic search, right? Dentist near me. What Google's going to do is it's going to pull in, as Len said, the map pack or the 3-pack. And it's basically what Google does in this type of search is Google knows, A, where you are, so me, the searcher, and B, it's going to look at my question, which is show me a dentist near me, and it understands if I am asking a question of local intent, okay? So when you ask Google a question or a query that has local intent, like this one, it will show you a map pack. And what this map pack is it's giving you the 3 most, what it perceives to be the 3 most relevant answers to your question. So it's basically saying, where am I, the searcher, and what are the 3 most relevant and prominent answers to the thing that I'm asking. Okay, so for example, if I went to Google and I typed in COVID, there's no map pack here, right? Because there's no local intent in my question. Okay, so going back to that search that I had of dentist near me, if I'm a dentist, an orthodontist, I am servicing a local market. I am pulling in patients from, 3, 4, 5, 6 miles from around my practice in a general sense. So being visible here is very, very important to any business owner, whether you're a physical therapist, a doctor, a dentist, whatever you may be. Somebody searching for something that you do, you want to be seen here. 60 some odd % of all Google clicks, of all search clicks, come to one of these businesses. So an inordinate amount of clicks come to one of these 3 business listings. Now, what people don't realize about this 3-pack is that it's not the same. It is a proximity-based experience. And all that really means is what I see here, so this business 1, business 2, business 3, would be different if I was, let's say, 5 blocks down the road, east. Or if I was a half a mile in the other direction, what I would see if I asked the same question would be different. So Google will display different results to different people based on where that person is. So we have the ability to take a business's Google listing, which is what this is, and essentially transform it and help rank it. So let me show you what I mean. So here is, I'll use Len because Len is a great example. I'm going to pull up Len's practice listing, and we're going to look at the keyword dentist. Okay, and what this little grid shows me is it's really quite simple. Len's practice is the center pin, this number 2 right here in the middle of this grid. Every dot that we see is a half a mile apart. So every dot is actually pegged to a specific latitude and longitude. So all this little tool does is it looks at a specific area on a map, and it asks the question, if I lived at this dot and I asked Google, show me a dentist near me, what would I see? Where would Len's practice rank in that map pack? So we can see where there's 1s and 2s and 3s. That means he's in the 3-pack. So it's showing you where he had visibility. Now, this was back in August of 2019, right? And it's color-coded. So, if I click on the number 2, this is actually back in time, so I can't pull old data. But when we fast forward and we go through today, this is as of May 24th, you can see how that map has radically shifted in terms of the color coding. You see all the 1s and the 2s and the 3s versus what it looked like back in August, right? So what this essentially means is at a local level, right? So this map goes out a couple miles. It's like 3 miles in every direction. At a local level, lens listing is coming up in that 3-pack exponentially more and being seen by his local population way more than it was before we started working. Back in when I started working, back in, I guess it was August, September. So you can see the shift in that visibility. Does that make
Well, actually,
make a little bit of sense?
I find that incredible that that is possible for you to do with a click here and there. Now, Len, or actually the two of you, but Len first, how does social media, social reputation management, how does that affect these rankings?
So I think that the best answer to that is that, as Evan, it doesn't necessarily affect the rankings because Evan has a different way of dealing with the rankings than someone like myself does. But as your visibility increases and you show up higher on the map, you need the credibility to help attract the new patients. So having reviews is an important way to make the marketing that much more effective. So a combination of what I do, which is help dentists get better reviews online, we make it easy for the patients to do it. And then what Evan does, which is help them get higher on the map section of Google, then those two services combined has a tremendous impact on the way a practice is going to perform online. They're going to see a large increase in new patients. When you ask the patient how they found about you, they're going to say Google, and you ask them why they chose your office, they're going to say because you had the most or the best reviews, or they're going to talk about a specific review. I just had a patient that came in, called us on the phone, and said that they liked what people had to say about how we were dealing with COVID in our practice, so they decided to come in because of that. Again, it was a combination of me being visible in the Philadelphia area, but also having the great reputation that I do have. So it's a symbiotic relationship between what Evan does and what I do.
So am I understanding this correctly? That just because an individual business doctor is getting more Google reviews, that doesn't mean that they'll make it into the 3-pack? Is that correct, or am I wrong?
Evan, I think that's a better question for Evan to answer first, and I can follow what he says.
Evan, go ahead.
Is Evan there?
Evan, I think he put himself on mute.
I don't even see him. So, all right, well, I'll answer the question then. So the answer to the question is that basically reviews have an impact on local ranking 100%. Okay. What Evan does is take someone who is struggling to get into the map pack in a much more competitive area, and then the reviews that we're getting for them will make it that much better. So it has a ranking factor. You're not necessarily going to find someone with a lot less reviews or no reviews or only a couple reviews on the map pack. But if you want to rank higher, you need reviews, and then what Evan does as well. So it's a combined symbiotic relationship, like I had explained.
Now there's some sort of glitch. Evan is gone.
Hopefully Evan rejoins. And hey, technology is great. It happens all the time when I do my Facebook Live. People disappear, and I'm the only one left. I'm like, well, how do I have a conversation with myself? At least we're here now, so we can still converse until Evan rejoins.
Yeah, I've often well, when it comes to Bird Eye, which I have some familiarity with, but what I'm curious about is how do you see things differently post? Well, it's not post-COVID. It's affected by COVID because we still don't know where this is going, and we're not coming out of this the same. What would be your comments about the services that you provide in social media pre-COVID versus what we're in now?
So the biggest thing that I think you'll find is that patients are more astute or attuned to or potential patients are more astute or attuned to what other patients are saying about practices right now. They're very into making sure practices are safe. to come into because of the way they're being protected, both the patients and the team. I have actually made a prediction well before, as a time as you're aware of, Google during the major part of COVID, when practices were closed, they shut down the ability for business to get reviews. So for a good 6 to 7 weeks there, you weren't able to get reviews from the patients. The practices couldn't respond to reviews. They shut all of that down. That was on purpose. Now that we're back up and running, they've now allowed the reviews to start coming back onto Google once again. So when that happened, I said, okay, now that you're able to get reviews again, I guarantee that the biggest focus of these reviews is going to be on the PPE that you have, on the way you're protecting the patients. That's what they're going to want to be looking at. So that's the focus. They're not going to be talking about the dentistry anymore necessarily. They're going to be talking about the experience that they had when they came into the room, that they felt protected. They took my temperature. That's what they're going to be talking about, because that's very different to what's happening than before. And I get emails every day because I've asked the people in my Facebook group to post or send me pictures of screenshots of the reviews. And a lot of them are directed 100% to the fact that they felt safer, that they had a great experience post-COVID, and that's what they're talking about. And I think that's the biggest change, is that it's going to be more focused on the customer experience part of it with COVID than the dental part of it, which has always been there.
Yeah, there's no doubt. Everybody, I mean, those are things. It's sort of like when the comment in research is that great research always makes sense and it answers a glaring question very clearly. Now, in research, what's fascinating to me, and also Len would be in on this, Evan will get in on it from what I'm about to explain, but this whole idea of evidence-based and the scientific method. Well, boys, do you know that right now that there are instances of doctors taking board exams to be board certified in different specialties, dental, pediatric dental, orthodontics, oral surgery. But I know specifically instances where the candidate being examined, when they're asked for a scientific reference, they reference Google. That's not a scientific reference. But Google is, without a doubt, the biggest market maven that exists. People actually think that they're facts. Now, what we're talking about right now, Evan, is how things are perceived and also how they should be marketed more strategically now that we're in this quagmire of COVID, basically quicksand. How do you see things different, Evan, now versus just a few months ago?
Well, unfortunately, it's not a question I can answer where it's a one size fits all, right? So what I have, for the vast majority of my clients, comparable to a practice like Len, the push isn't on patients in seats. Okay, so for the last X amount of years, every dentist, doctor says to me the same thing. I just want butts in seats.
Yes.
That's the catchphrase I get probably 8 to 10 times a week. And I've really tempered that with the focus now should be on awareness. Just to literally jump right off of what Len said, make the patient, because people are hesitant to go to the dentist specifically. It is not something that is, for many of us, they consider essential. I can put off going to the dentist for 3 more months, 4 more months, 6 more months. The way that you're going to speak to that audience is by promoting the awareness of the investment that you've made in your practice to protect the patients. So show me why your practice is better than the competitor in terms of my safety, my children's safety, my family's safety. And so therefore get me in the door that once, and I probably will continue to come back solely on the merits of you made me feel really safe. And when I left, I didn't feel like I was in harm's way at all. That's really the messaging I think that needs to be promoted, at least for the next 12 months. because the anxiety, you're really talking to anxiety more so than you are talking to people's, wallets per se.
Well, I really like the saying, and this is not original with me, that facts really do not change people's behavior. What actually changes somebody's behavior are emotions.
Correct.
And if someone, when there is no reason to not have a pleasant experience coming to the business, to the office, to the dental office, there is no reason to not have a pleasant experience. So within Nathos, what I'm emphasizing to people ongoing is no complaining, no eye rolling from the team. Oh, look where they're making us do now. Look at all this stuff we had to do. And especially not from the doctor. That this is essential, and safety safety brings trust. And if someone does not feel safe, if someone does not have a pleasant experience and feel safe, it's cut right out of Disney. It's right out of the four cornerstones of Disney. If that is not a primary objective, in addition to very good dental health care, but if the primary objective is not for people to feel safe and have a pleasant experience, they're not going to come back. And even worse, Len, right? They may zap you on social media.
Yes, they are 100% so. If they have a bad experience, there were people that were saying that, that you're disorganized, that, you haven't like set up your flow in the office, but they're going to go and bash you, whether it's on Facebook, whether it's on Google. And look, I have a class called, "Oh my God, I got a bad review. What do I do?" Because it's a big problem for people. But there's a way to overwhelm these bad reviews with simply getting more of them. But it's a big problem when people as in dentists freak out when they get a bad review. And, it's bound to happen. It's going to be something that happens many times during your career, because we're not perfect, and no business is. But especially now that we're trying to get back in business and get our practice up and running after being closed for 60 plus days, I think it's even more important to pay attention to what's going on, and just being giving much more personal attention to your patients than ever before. In our office specifically, we've turned off all like automated communications. We're calling patients to let them know the new policies in the office. So we went back to that personal touch, which patients we lost a little bit when we sent everything out that was automated. So, and patients are commenting about how they feel back in touch with the practice because of that. So there's little things that you can do to make the patient feel important. And if they feel important, they'll want to come back, and they'll refer friends and family to you, which is even better.
There's an interesting study, and then I'd like to hear from Evan again, his input on this, but there's an interesting social study. What's the number one thing that people want to encounter consistently? Now, it doesn't matter if it's a dental office, a restaurant, if you see a friend, and of course now we're seeing lots of friends virtually. What is the number one thing that people want to encounter? And the number one thing people, when I ask this to a group, and it's a question where I have a discussion with the group, I'll say, well, what do you think it is? Well, people say a smile. Okay, right. But it's more targeted than that. People will say someone who calls you by name. Right. But it's actually more specific. The number one thing, and think about what you think it is, the number one thing that people want to encounter. What's the number one thing you want to encounter when you call a friend or they call you? Someone who is happy to hear from you, or someone who is happy to see you. They're actually happy to see you. They're not faking it, or you can hear it in their voice. You can hear it in their voice if it's over the phone. So I think that it is absolutely critical that the team be aware that it is never a bad day at the office. It is never a bad day at the business. And the team should be happy to hear from these patients. The team should be happy to see these people, because that's their job security. Evan, what input do you have for us?
So, what was interesting about COVID and the shutdown specifically, as it relates to dentistry, is that when it all happened in a matter of days, a vast majority of the businesses that I work with and doctors that I work for were all shut down. And so the phone was ringing 24 hours a day for me. And this was uncharted waters for me. And as much as I can tell you about SEO and digital marketing and certain aspects that I have expertise in, I really needed to think through what I wanted to do and how I could help a lot of these doctors navigate, this experience. And what I realized, and the one piece of advice that I gave them, I said, you come to me as a digital marketer and I can talk to you about sending out emails and text messages and posting on Facebook and and all these kinds of very distant messages and forms of communication. The one piece of advice that I gave every single doctor, the only piece of advice that I gave them was pick up the phone and call every single patient. Divide and conquer. Your staff, make 50 calls a day. If there's 3 of you, 2 of you, however many people you can assemble, say, call, hey, Mr. Johnson, we're just calling to check in because I want to see how you're doing.
That's right.
And towards the latter end of that message, it was, and here's what we're doing when you return. We're going to implement these 3 major safety precautions for the benefit of you, Mr. Johnson, so that you at least had some way to communicate that in a much more personal way. And I said this to a bunch of people in this COVID experience. Now, I don't personally go to any physicians that I work with. All of my doctors I have no business relationship with at all. By design, I didn't hear from one of them. Not to say it's their responsibility to call me. It's not. It's not part of their job description. But it's interesting. Nobody really reached out to see how I was doing or if I was even sick. Wouldn't you as a doctor want to know if I was your patient, potentially if I was exposed to it or had it? And I'm not saying that that's information that needs to be shared with everybody, but it's just, I said, if you really want to make a lasting impression on somebody during this, pick up the phone and see how they're doing. Show them you actually care about them.
That is nothing short of brilliant. I think most people have had an experience where they might have had some sort of general anesthetic. Well, the first time that I had to have any general anesthetic for kind of a routine exam, as my physician said, for a person your age, what shocked me was that evening, the anesthesiologist called me up. I mean, it was an outpatient procedure, but the anesthesiologist herself called me and said, look, I'm just calling to check on you. Everything, you okay? It was like a few seconds. And I said to her, I want to ask you something. Are you calling me because I treat your kids? And she said, oh, no. I call everybody. And you'll be hearing from somebody else, your other physician here, your primary care physician. You'll be hearing from that person too. And maybe an hour later, I got another call. I was really impressed. So I can identify exactly with what you're talking about as far as showing concern and compassion that's genuine. And I think you said something interesting that the doctor herself, it's not critical that person do it, but somebody should do it.
It was divide and conquer. I mean, a lot of people were going through a lot of situations with their staff and furloughing people and all sorts of things going on individual to each business. But the one thing is, I got to send an email. And I'm literally looking at my email inbox and I am getting COVID email after COVID email. Target, Walmart, Burger King, you name it. Everybody sent me a COVID email that had a business, to the point where it just fell on deaf ears. I mean, so I said, if you really want to make an impact on these people that's going to resonate on them, don't send them any emails. Everybody knows about COVID. You're not going to tell them anything they can't see from the other 500 emails they're getting from everybody else. You want to make a statement, make a statement. I got 800 patients. I've got 2,000 patients.
Right.
You want to dominate. You want to be the best. you got to roll up your sleeves and sometimes, and do the hard work.
Yeah, compassion and concern. That's for sure. From your standpoint, Len, and I think it's interesting because I was not really aware of the differences between what the two of you do. I know that you work very closely in business, but you have separate businesses. Clarify for me, again, Len, from your standpoint, how does what you do with your business and with Bird Eye differ from what Evan does?
Well, we help the patients actually generate the reviews. We'll do some other things that will help them get some more visibility, but ultimately Evan's going to help them, and focuses a lot on his local SEO, but he also has SEO, which is below the map section. So my services are solely focused on the map section of Google. So we're going to get them more visible and credible there. Evan has SEO, search engine optimization services that gets them, visible on the organic rankings as well. Evan also does Google AdWords. So he focuses on paid search, organic search, and local search. So I'm focused more on the reputation and local search on my side.
I tend myself, I'm always curious as to if other people feel the same way, but I tend to not click where it says ad. And I know that Google has to do that. I tend to say, yeah, well, I get it, right? You're paying for this. I tend to kind of look below that. Evan, how do you feel about that? Is there some input you can give me that about that feeling?
Yeah, you're like the majority. 13% of all searchers will click on ads.
13% of all searchers.
Correct.
That's a low number.
It's a low number, but it's also an effective, in dentistry, it can be very effective because when somebody wants something or they need something, sometimes they just want to click on the first business they see. So having that top of the page ad run can be a very, very effective way to capture patients. You don't need to get a lot of clicks per se in paid search. You just need to be in front of the right people. In my world, what I do in a perfect scenario is a doctor would be running some ads at the top, right? Those paid search ads. Their practice would be visible in that 3-pack. And then their website would also be listed below that organically. So when you look at it mathematically, there's only so many links on page 1 of Google. If your practice essentially captures 3 of those potential clicks, you exponentially are way ahead of your competitors.
Well, the saying I like is actually from Lyle Johnston. So I'd like to give him credit. His saying is, no matter what, if you're a player, know the game, play to win. And I think that in the social media marketing and in the SEO realm, the two of you would be, as far as I'm concerned, at the very top of expertise. Closing remarks. Len, what do you have in closing?
Well, I still think it goes back to what I was saying before. Reviews are not going away. They're going to be as important as ever. They are going to help drive new patients to your practice. They also are the keys to unlock any marketing you're doing. So if you are marketing your practice, not being successful, not seeing success, you add a little bit of reputation to it. It will add the fuel to the fire that gets the marketing ROI significantly better. So we are a reputation society. Everybody reads reviews on everything that we do. You got to make that a focus of your marketing. Add in what Evan's going to talk about and what Evan does, and that combination really takes you from being what we said was being invisible to being not only visible but credible. And visibility and credibility equals more new patients coming in your door.
Now, just a reminder, as I said in the very beginning in the introduction, the links to connect with these two gentlemen appear just below where it says show more below the YouTube. You'll see the links to connect with them. Closing remarks. Evan, please.
Well, I'm going to sort of just dovetail on your opening remarks, which was visibility. If your practice and your business is not visible to your local search population, your local audience, you're always going to struggle in terms of growth. And I'm gonna even lob it back to Len. You know, Len's in a really unique position because Len is not only a dentist with his own practice, but Len talks to thousands of dentists throughout the course of the year. And so, Len, the question I'm going to ask you, because I don't think there's any better person suited to answer it, is what is the difference between an owner that has really strong visibility, you know, in terms of the performance of the practice versus the practice the owners that you talk to that have all sorts of visibility issues?
Well, they struggle. The ones with visibility issues are definitely struggling with attracting new patients. If they're, let's take an insurance practice, they don't have problems with new patients because they're the insurance patients that are coming in. They're not finding them on Google. The practices that are not insurance heavy are definitely having a problem getting new patients, and they're getting 6 to 8, 8 to 10 new patients a month. They want to get up to 15 and 20. And the biggest connection I can tell you there is that they're relying solely on word of mouth. Word of mouth is now online. So you have to have that visibility in order to get those new patients coming into the office. It's that simple. You do that, you significantly allow the fee-for-service patients looking for a dentist to find you online. And that's the connection that there definitely is.
Yeah, word of mouth now being online, as Malcolm Gladwell points out in the tipping point, market mavens. Without that component, without that market maven component, the business is not going to thrive. They may tread water, but they're certainly not going to thrive. Evan, Len, thanks a lot for your time. Thanks a lot for your expertise. Again, you can easily see how to connect with these two folks. Boys, I'll look forward to seeing you again soon and talking with you soon. Thank you.
It's a pleasure. Thank you, Jerry.
Thank you, Jerry.